Hi, I'm Dr. James Machino. What are symptoms of prostate enlargement, or BPH? Well, BPH, or benign prostatic hyperplasia, simply means an enlarged prostate gland. And a prostate gland that's enlarging is sort of part of the normal aging process to a large degree. And you start to get signs and symptoms that can be very uncomfortable and troublesome. So as the prostate enlarges, it's sort of squeezing the urethra, where the urine normally would flow from the bladder out to through the urethra and out of the body. And so as the prostate enlarges and squeezes the urethra, men have difficulty initiating urination, so we call that hesitancy. And they have to urinate much more frequently because you can't totally void all the urine out of the bladder. There's going to be some residual volume there. So men have to, they're always looking for the next men's room because they're urinating frequently. And with that, you can get painful urination if you start to get enough pressure on the urethra. And as the urine sort of pools in the bladder, you can get this retrograde flow and start to get a greater risk of urinary tract infections. And the problem can even, men often have, frequent nighttime urination as well. They have to get up a few times through the night. And if the problem's severe enough, it can actually aggravate problems of erectile dysfunction or be the cause of erectile dysfunction. So it's not a great problem to have. And yet, by age 50, up to 50% of men already have some prostate enlargement. If men live to be 80 years old, between 75% and 90% of men actually report enlarged prostate symptoms. And about 50% of those men over their lifetime will seek medical help because the problem is becoming significant. They just can't urinate the way they once did. And if there's inflammation associated with it, then in the blood, you might just see a rise in the PSA level, the prostate-specific antigen, which once you see a high PSA, the doctor has to decide, is this cancer of the prostate or is this inflammation or infection? So you may need to have a biopsy done, in which case the biopsy needle may actually stir up trouble and cause infection. So it's just a situation you'd like to try to prevent as best you can. So why do prostates enlarge? Well, after the age of 40, there's evidence that the prostate gland starts to convert more testosterone into a more dangerous kind of testosterone called DHT. And as DHT builds up, it causes the cells of the prostate to divide at a much faster rate. As that happens, there's a greater number of prostate cells, and you start to enlarge the prostate and squeeze off urine through the urethra. The other thing that happens is as men get older, they sometimes gain more abdominal fat. As your fat cells get larger, they make more estrogen, believe it or not. And estrogen slows down the breakdown of DHT. And so now DHT can also rise because men are getting fatter and they have more estrogen. So in the aging process, men are more prone to it. The pharmaceutical companies have created drugs that block the buildup of DHT. And they also have drugs that will relax the muscular coat around the prostate gland and around the neck of the bladder, so it'll take some of the pressure off and allow urine to flow. But some of these drugs have some side effects. What men should know is that there are dietary and supplementation practices and lifestyle practices that have been proven to prevent benign prostatic hyperplasia and have been able to reverse mild to moderate BPH problems or enlarged prostate problems. And they have active constituents that have been shown to be important in the prevention of prostate cancer. And these natural agents have fewer side effects than drugs. But if you're on those drugs, you can use these natural agents along with the drugs to actually get a better effect in terms of prostate support and reversal of symptoms. And this is important because a lot of these ingredients have very important anti-cancer properties that are vitally important because prostate cancer is the second leading cause of cancer death in men in this part of the world. Studies show that 75% of those cases could have been prevented with better dietary and lifestyle intervention. So all men need to know the information that I have about this. Most medical doctors don't study enough nutrition and natural medicine to be on top of the latest research, so they don't emphasize it enough. Even the Prostate Cancer Society, they do a good job of creating awareness for men to get a PSA test for early detection of prostate cancer. But at the end of the day, they don't really give the lifestyle and nutrition and supplementation advice that's important for the prevention of these problems and can be used to reduce enlarged prostates from getting worse, and can be used in conjunction with the medical drugs that are used. So what I've done is I put all the information you need to know into an ebook called Natural Remedies for Prostate Enlargement, Prostatitis, and Prostate Cancer Prevention. It's an ebook that every adult man needs to read. It's available right here. It's free. Remember that prostate cancer is the second leading cause of cancer death in men. Every man needs to take a look at this because the same biological processes that lead to an enlarged prostate are also linked to prostate cancer development. You need to halt those processes. So download the ebook right now. Now remember, at machinohealth.com you'll see my other research review papers, other videos I've created, footage from my live seminars, other downloads and resources I have there for you that'll help you lead a long, healthy, functional life. All my research papers and teaching materials have all the scientific references in them, so you know you're getting sound scientific information from me on any health topic that you're looking for. So you really should make machinohealth.com an ongoing, reliable resource for health and wellness information for both you and your family members. Thanks so much for watching.